dietitian, nutritionist. I'm born and raised in Sandusky. I actually live in the Cleveland area now, but I played basketball and studied public health in Pennsylvania for Slippery Rock University. And then I also studied nutrition at Kent State University. And then I also studied more nutrition at the University of Kansas Medical School. I'm currently studying more nutrition through an Integrative and Functional Nutrition Academy. So, Brandis had asked me to come and just talk about some of my favorite things, which is food and nutrition. And so I was trying to decide as to what I should talk about, because I could probably sit up here for 15 hours and just talk about food and nutrition. And another part of what I do is I do one-on-one counseling. I also am a food blogger and a recipe developer in the Cleveland area. So I work with restaurants and grocery stores and food products. So food is my jam, and nutrition too. But anyways, I was trying to figure out what topic I should talk about. And I relayed a few of them to Brandis, but I really thought this one would be a really good starting point. I am going to talk again in May on gut health, because it's a very trending, in a very good way, topic. But I thought this would be a really good topic to start with, because at the end of the day, I get two main questions every time I see someone is, what diet should I follow, or what should I eat? So I figured, I'd break down some of the diets that are going on right now, the popular diets, and go from there. If you guys have any questions while I talk, because I'll just talk and talk and talk, please stop and ask.
She's my nutritionist.
All right, so how many of us have heard of this one, ketogenic? It's extremely popular right now. And I don't want to use the term popular, because I feel like, oh, sorry, by the way, this is not printed off. But if you want copies, I'm happy to send you the PowerPoint so that you guys can print it off. But it's all laid out. So anyways, I try not to use the word popular when it comes to ketogenic. But if you don't mind, I'm just going to break it down, because I get this question very often. And I saw a few hands raised for the ketogenic. Basically, what a ketogenic is, it's a very low carb, moderate, not excessive protein, high healthy fat intake. What the purpose of a ketogenic is it causes your body to burn fat, which is ketones. And ketones are a type of fuel that the liver produces from stored fat. So remember this, your body is always going to use sugar as its main source of energy if it's constantly there. If it is not there, your body will go towards another source of energy, and that is fats. So that's where the whole idea of burning the stored ketones or the stored fat. If you restrict or exclude sugar from your diet, all sugar, so including carbohydrates, then your body will look at another source of energy, and that's where the fats come into play, and it starts burning the fats. If you want to get into the nitty-gritty, when I say low carbohydrate, it is extremely low. It's about 5 to 10% of your total energy intake or calorie intake, if that's what you want to look at it. So for example, for a 2,000 calorie diet, you only are eating about 20 to 50 grams of carbohydrates a day. That is very, very low. I like to talk about net carbohydrates. Have we heard of that term before? Basically what net carbohydrates is you take your total carbs from a food, look at the food label, you take your total carbs, you subtract your dietary fiber, and then you reach your net carbohydrates. The reason behind assessing net carbohydrates instead of just total carbs is you're not punished for eating fiber, which is really what is emphasized. We gotta eat fiber, it's extremely important for our health, blood sugars, lipid panel, inflammation, weight, all of that. Ketosis is basically your body burning fat as its energy. It typically occurs within 3 to 4 days of adherence to the diet. I'm sure now more than ever we've heard ketogenic, correct? It's probably been on the news. I've seen it on the news many, many times. However, when I said I don't like to use it as a popular diet, it's true because it's been around since 1921. It was first used to treat epileptic children. I used to work for the Cleveland Clinic, main campus downtown Children's Hospital, and I worked with a lot of children with epilepsy and ketogenic diet. Now, more than ever, it's being used as a neuroprotective intervention, so it's currently being studied for dementia, cognitive function, Parkinson's, Alzheimer's, and it's actually being studied right now for the management of type 2 diabetes and weight loss. The American Diabetes Association just released a statement supporting a low carbohydrate diet. That is huge, because the American Diabetes Association always turned their head towards this way of eating, and for them to acknowledge it does say something that it's not a trend, it's not popular, there's science to back it up.
When it says you're not punished for eating fiber, then we automatically sometimes I think beans. Now that's a carb too. I mean.
Yep. So it makes sense.
Okay.
Hold on, really quick. So what I've done is, you'll see I've only identified 4 popular diets. I'm going to explain what the diet is. I'm going to talk about the pros and the cons, and then I'm going to talk about the considerations for why it might be useful. So some pros for ketogenic, as we talked about, manage epilepsy. It is being studied for weight loss. There has been research to show that it can help with blood sugars. Does have a neuroprotective intervention component to it. Improved energy, cognitive function is always self-reported, and then decreased inflammation. And the reason why decreased inflammation is on here is because we are recommended to consume healthy fats and limited gluten intake. Just so we're aware, there hasn't been a lot of significant long-term studies on ketogenic. There are more short-term studies, so within 2 years. So the literature for long-term studies aren't really there. Now, you see the pro list. Let's talk about the con list. The disadvantages. I talk about this every day. To me, it's normal, but one of the most common side effects to following ketogenic diet that I hear is changes in bowel movements, specifically constipation. Why? Because we're not eating enough fiber. So Pat, just like you said, beans are an excellent source of fiber. However, if you've looked at beans, you know that they are high carb food. So for people who are following ketogenic, beans are not really allowed unless you eat them in very small amounts. So unfortunately, we are taking out a lot of fiber in our diet when we are following a ketogenic. Another thing is there's concern for nutrient deficiencies. That's because we're cutting out fruits. There's your beans, whole grains, and then those complex starchy vegetables like sweet potatoes. So a really big concern is inadequate fiber and B vitamins.
I didn't realize you cut out that.
Well, those are all carb. So fruits, beans, whole grains, and complex starchy vegetables are your carb-containing foods. So a lot of people who automatically go to a ketogenic, they just cut them out because it's easier, right? Another thing that I commonly see is that when we do a ketogenic, unfortunately, I see a lot of us cutting out all these healthy carbs and then replacing it with a lot of protein and a lot of unhealthy fats. So what I see is if you look if you Google search, or I don't know if we're into Pinterest, if you Google a ketogenic recipe, dairy is probably always going to be involved in that recipe. And a ketogenic guideline does not emphasize dairy. Dairy can be highly processed. So I do see we cut out a lot of fiber, but we're replacing it with unhealthy fats, specifically our saturated fats. Also, if you look at a ketogenic, a lot of people are eating a ton of meat, right? Because it is technically considered low carb. Unfortunately, when you're not working with someone who knows about the ketogenic, or a medical provider, or whoever, most people don't know that there is such thing as too much protein. If we're taking in too much protein, it actually turns to sugars. So it kind of backfires. Another one is sensitivity with blood sugars. That's a common one I see. If we cut out all carbs, I notice a drop in our blood sugar, especially for those who do have type 2 diabetes already, pre-diabetes, or just sensitivity to their blood sugars. They cut out carbs, they see a drop in their blood sugars. That can be corrected. It's just something that we have to be mindful of. And then there's actually a term out there called the keto flu. We experience nausea, headaches, and dehydration. Headaches probably from cutting out cutting out sugars, but also because of the low blood sugars. Some considerations. I am not here to say that ketogenic is bad or it's good, because I think it really, you'll see at the end of the PowerPoint, I think it's really up to that particular person. But what I would say, if anyone comes to see me or I'm just walking down the street with my dog and someone stops me and asks me if I should follow a ketogenic diet, I would say, think about this. Sustainability is probably, in my opinion, the number one factor to think about anytime you try a certain way of eating. I've been a dietitian for about 6 years now. I've seen a ketogenic now more than ever within the past year. I've also seen about 99% of people who follow a ketogenic diet, they do not continue with the ketogenic diet because it's hard to follow. It is pretty darn strict. You are excluding food groups, and it can be hard to follow those types of guidelines, as you can see. Another one is think about those current medical conditions. Blood sugars is one. Individualized needs. Well, what's your family history? What's your genetic component? What are you looking to get out of this diet? Thinking about individualized goals. Cost, huge one. Ketogenic diet does not support or does not recommend going to eat all the bologna and hot dogs you want. Although it is technically considered a low carb, it does actually backfire, and we have to think about our heart, our arteries, our plaque, all of that. So when it comes to cost, it can be a little bit more pricey. I see some patients tell me, because you're looking at your higher quality meats and things of that nature. Family, it's a huge one. I always want to bring that up. If you're following a ketogenic diet and everyone else in that household is not, it can become difficult. So having that good support system around you, or figuring out what the entire family could do. Cooking skills and tools. Your schedule is a huge one. Work and life. I know that you guys are up early, all day working, so you have to play that into a role. Accessibility for some of these foods. So grass-fed beef, pasture-raised eggs, those are all really encouraged. I'm a dietitian, but I'm also a human, and I know one, those are more expensive, and two, they are harder to find. And then ethics, some people will choose not to eat animal products entirely. Yeah, please. Go ahead.
On the ketogenic, and I just have a question.
Please.
Because my mom had something where her doctor put her on a diet very similar to this. In fact, you couldn't have pig either. She had to be checked once a week and have blood work done to make sure that everything was, I don't know, her blood work, that the sugar or whatever else wasn't
Being affected.
Yeah, and they eventually had to take her off of it because of medical issues with it. So is this something that should not be
Followed?
Well,
no, there's research behind this type of diet. I don't know if that was a ketogenic by any means, but if you're having weekly blood work drawn, that I can't really answer. It might be a protein sparing diet, which could have been, but you can test your ketones in your urine to tell if you're in ketosis. This one is not by any means, I'm not saying this is a bad diet. I'm also not saying it's a good diet. It just is very dependent on that person. I've tried this way. I will try anything just so I can understand where, a patient or a client is coming to see me. For me, very sensitive blood sugars. I did get the headache. Cost is a huge one. And I think, this probably is the number one thing. Is
I know when
sustainability.
she was done, they increased, then she went back to vegetables and decreased the meat.
Oh, okay.
So she was able to sustain
Yeah.
her huge weight loss with it. But again, I watched her when everybody would eat and she'd have a cheese stick or something.
Yeah, it's hard. It's a very strict way of eating. And so anytime that we talk about eating habits or diets, is this something that you can continue to do? Yeah, you may be able to tweak it here and there, but is this kind of eating habits something that you're going to be able to follow? Because if the answer is no, why do it? You know what I mean? Because you can lose the weight. That's one of the main things I see on keto is the weight gets dropped. But then people notice that it's a very not unrealistic, but a very hard diet to follow. So what happens? they go back to some of those old eating habits and the weight gets regained, which is just as unhealthy, if not more unhealthy, than the weight that we started at. So, how many of us have heard of the Mediterranean? Actually, in January, it was named the best diet to follow in 2019. Just so you're aware, there is a physician at Gnomes who is heavily Mediterranean based, loves it, swears by it. There's also research to back this up. But the Mediterranean is basically a generic term that describes typical eating habits in the countries that border the Mediterranean Sea.
And I heard the same thing, that was, the whole idea of that sort of was flawed because it was at a time that the initial studies when there was very little of certain things available because it was after World War II and World War I. I mean,
You'll hear that too about and I could have an hour conversation about that. Any nutrition research out there always comes with the red flag because to study nutrition in humans is extremely difficult. You can't take 10 people, lock them in a room for a year and force feed them. A lot of nutrition studies are self-reported, which is we know when you self-report something, we have a tendency to not say some things that maybe we should be truthful about. Another thing is that there's limited research and funds behind it. So a lot of times when you look at, that's another thing about research. When you look at these studies, look at who's funding it. It's quite eye-opening. So yeah, I mean, a lot of research does come with some considerations in itself. Now, whether or not it's the Mediterranean, I think the big base of it is that how I describe it is plant-based with emphasis on healthy fat. So I'm not a numbers person, but you see it's heavy on your vegetables, it's heavy on your fruits, it's good on those grains, choosing mostly whole grains. One of the key distinguishers between the Mediterranean and any other diet is olive oil, extra virgin olive oil, and fatty, oily fish. So they do encourage olive oil or extra virgin olive oil, avocados, nut butters, things like that. Nuts and seeds, beans and legumes. This one right here, and then that one is probably the two main differences in this type of diet. 2 to 3 servings of fatty fish weekly. And what are fatty fish? Salmon, sardines, mackerel, anchovies, and that's about 8 to 12 ounces per week, so about 4 ounces per sitting. Now, truth of the matter is, are we eating sardines and anchovies 3 times a week? Probably not. I do really try to encourage people to try some of these fish. I don't like sardines or anchovies, but I am a big fan of salmon and mackerel. Tuna is another one. But yeah, so that one's a big difference in the Mediterranean. Another one is if you look at the meats, the yogurt, the cheese, the eggs, the dairy, the poultry isn't really emphasized as a staple in the diet. It becomes more maybe daily to weekly. So it's really all your plant-based foods supplementing with some animal products. Alcohol or wine, they are a big fan of red wine. But what's really not recommended is the red meats, processed meats, and added sugars. It was named the best diet to follow in 2019. In my opinion, why? One, it's heavy on plant foods. 2, it's not as strict guidelines. So it's really just saying, eating real whole foods, mostly plants.
That's weird. With the oil, that kind of surprises me that'd be a big thing of it. Because isn't that just basically the stripped out, isn't just the fat in the
And the olives? Yeah.
I mean, is there any real nutrition to it?
Yeah, so your olive oil, especially your extra virgin olive oil, there's different grades of olive oil. It was a really cool learning experience for me when I was learning about olive oils. Basically, your extra virgin olive oil is your least processed. It's your more prime olive oil. It is heavy in monounsaturated fats, so your omega-9s, which we know as omega-9s, they can decrease inflammation. They do have a positive effect on our blood sugar, cognitive function, so all your healthy fats, think brain health. So yeah, it does have, and here's a little tip that most people don't know. Extra virgin olive oil is really meant to be a dressing or like a dipping. So if you look at, if you go to an Italian restaurant or anywhere in the Mediterranean, what is your bread dipping component? Olive oil, extra virgin olive oil. When you put extra virgin olive oil up against high heat, you are breaking down some of those nutrients. So that's a little tip I give. Think about when you are sauteing or cooking with olive oil. Let's say you get home tonight, I know I'm going to be wanting something quick and easy. So if I'm frying or sauteing at a high temp heat, I wouldn't necessarily recommend extra virgin olive oil. There is avocado oil out there that has a high smoke point, which is actually just as good. It's an omega-9, but it has a higher heat tolerance. Does that make sense? So there is nutrient value to olive oil and extra virgin olive oil, but I just didn't put, olives could be right there too.
Yeah.
That's what I was gonna say, how come I just can't eat an olive?
Yeah.
Not that I want
That's
to.
what-
You can,
You could do that too.
yeah, I just didn't put it there. I try to distinguish the main components to it. The extra virgin olive oil is a huge one. Why? Because salads are really big, those vegetable side dishes, and then they just, not they, I'm talking as if they're my best friends. The drizzle of olive oil is included. I like the best friends in the Mediterranean. All right, so pros and cons to a Mediterranean. How many of you have heard of the DASH diet? Dietary approach to stopping hypertension. It's basically a very similar type of eating. The only difference between the DASH is they do encourage low-fat dairy. The Mediterranean is not really emphasized in that aspect. But with the DASH and with the Mediterranean, one of the biggest researches to date is on heart health, lowers risk of cardiovascular disease, lowers blood pressure. There is some research on weight loss and weight management. Blood sugar management, and here's why. Did you see when I said the ketogenic has been shown to improve blood sugars? The Mediterranean has been too, because it emphasizes fiber intake. Fiber stabilizes blood sugar. Fiber is extremely important for our health. It makes us feel full, it tags onto your sugars, and it helps to stabilize your blood sugars, which ultimately can help lower them if we're looking at a high blood sugar situation. Cognitive function and decreased inflammation, because they don't emphasize processed foods, your processed meats, and your red meat, and added sugars. Some cons to this are that I do tend to see that they are people who follow this way of eating kind of go overboard on carbohydrates because it does emphasize the grains. Another thing in the Mediterranean is that they do not really clearly define portion sizes. So a lot of times I see excessive intake because some people like that structure on how much I'm eating exactly, ounces, all of that. So portions are not really explained that well. And then I do see weight gain at times, like I said, because of the higher carb intake, especially if it's coming from processed starches. Another thing too, with the Mediterranean lifestyle, there is a huge component on being part of a community and the social setting and staying active that is always underestimated. We always really focus on the food, and even as a dietitian, that's what I'm going to talk about, but I do think it's extremely important to think about those other factors to our health as well. Has anyone ever heard of the blue zones? It's really fascinating. If you did a quick Google search on the blue zones, they've identified, journalist turned scientist and researcher identified, and his team identified about 8 different areas of the world and have labeled them as the healthiest areas of the world. And they've identified factors to why it's researched as them to be the healthiest. And what I mean by healthiest is the least account for cancers, for diabetes, for heart disease, all of that, and the longest living humans. Part of it emphasizes eating as a group, so eating as a community, being part of a social setting, exercise, and plant-based foods. It's a really cool read. There's a book out on it too, but yeah, it's called The Blue Zones. So the same thing when it comes to the Mediterranean is think about sustainability, current medical conditions, individualized needs, cost. I oftentimes hear healthy eating is expensive. I could really talk about budgeting and eating on a budget. And then, think about skills, cooking skills and tools, accessibility, And then if you're really one that likes more guidance on portion control and structure, that's something to consider. Paleo. How many of us have heard of the paleo? So the paleo is really coined as the caveman diet. It's basically their thought process is foods that were obtained in the past by hunting and gathering. Those are your vegetables, fruits, lean meats, poultry, eggs, fish, nuts, seeds, and the healthy oils. Foods that are not included are really your grains, soy, dairy, gluten, processed sugar, packaged foods, and gluten. Again, I apologize. The thing about paleo is that there's really not a lot of research on it. There has been a little bit of research to show that it can reduce the risk of heart disease and also decrease inflammation. I personally don't feel like we needed to pay for a study to show that, but that's the food and nutrition research. There is a small population study, and if you guys ever want some of these studies, I'm happy to give them to you, that showed improved blood sugars and blood pressure in addition to weight loss. Just so you know, in 2017, there was a meta-analysis study that compared the Mediterranean diet with the paleo diet, and they found both were effective. And I'll tell you my thought process and my assumptions as to why they were both, they could be both good. Paleo, the pros, advantages, weight loss has been shown, improved blood pressure and sugars, decreased inflammation, improved digestive issues, improved energy levels, and improved autoimmune symptoms. Number 5 and number 7, I will attribute to gluten. How many of us have heard of gluten and that trend? Gluten has been shown to be a pro-inflammatory marker in our diet. There is phenomenal research to support cutting out gluten. You do see an improvement in digestive issues as well as autoimmune symptoms. I often see, and I'm not here to say cut out gluten, maybe we have to consider what's going on, but to give you an example, I recently saw a patient, IBS, significant IBS. We cut out dairy and gluten, and it's almost like it went away.
So how do you determine which one it was?
We don't do it at the same time. You can do it at the same time. I look at so it's called an elimination diet. You can actually eliminate your top 8 allergens. And when I start to talk about that, people just look at me like I'm a ghost, and it's very overwhelming. So I do it one of 2 ways. We'll start with 1, see how you feel, and then we'll go on. Or you can do multiple at once, and then after 4 to 6 weeks is the rule of thumb. You start slowly adding back in, and you find out what your body can tolerate and what it wants. That's what I call an elimination diet. A 4 to 6 weeks, you eliminate some trigger foods that we might work together and feel may be a potential trigger. See how you feel. And then after 4 to 6 weeks, you can slowly add back in to see what your body can tolerate. Some disadvantages or thoughts to consider. Number 1 is huge, inadequate fiber intake when you're cutting out whole grains. Some people do tend to go low on the fruit side of things when we're following a paleo. And then again, there's my bowel movement talks, constipation. Too much protein intake, which is huge in paleo. People just automatically assume it's just a ton of meat, and that is not true. And remember, too much protein can turn to sugars. High intake of unhealthy fats, again, your meats and your dairy, processed meats, and then your nutritional deficiencies because of the inadequate fiber intake, your B vitamins, inadequate fiber, and vitamin D, which I'd argue is a nutritional deficiency for a lot of us, especially living in Ohio. And I could talk about supplements are one of my favorite things to talk about. So same considerations when you're looking at the paleo. Cost is a huge one, like I talked about. Family, seeing what everyone, what works for everyone. I had someone come in to see me, and spouse was following a keto, and he or she wanted to pull their hair out because it was just a high tension. Cooking dinners became a challenge, things of that nature. Vegan. Vegan is basically a more strict Mediterranean. What it is there's no animal consumption whatsoever. So animal consumption coming from meat, poultry, eggs, fish, and honey. There's also gelatin, which I'll talk about down here, that most people will not take medications because of the gelatin found in them. Emphasis is placed solely on plant-based foods. Your fruits, vegetables, beans, legumes, nuts, seeds, whole grains, your plant-based oils. Dairy and meat alternatives, that's where the almond milk, the coconut milk, things of that nature come into play. And then intake of soy, tofu, edamame, tempeh. I do see this, not always, but those who typically follow a vegan lifestyle also do not really support any type of animal cruelty at all. So I do see pushback on leather, makeup that's been tested on animals, and other products made with animal products like collagen and gelatin. Just so you know, when I like to talk about the research behind these things, there is a huge, there's a pretty good argument on the vegan lifestyle and the association with our environment. If anyone's ever interested in that, and what I mean by that is the animal carbon footprint is significantly more than growing produce or plants. And the required water intake for our animals is significantly more as well. That's not from a health standpoint, that is from an environmental standpoint, but that is a big argument for those who are very passionate about following the vegan lifestyle. But you could probably say the same for the Mediterranean as well, because it is emphasized on plant-based foods. Your pros, another one, huge, is heart healthy, because processed animal intake does attribute to our heart and the arteries, so lower risk of heart disease, lowers blood pressure. I do see some weight loss and weight management component of blood sugar management as well, because like I talked about, is high fiber. And then your environmental benefits, if you're interested in that, that is an advantage. Some disadvantages that I see is that I often find people going from meat eating to no meat, and we replace the animal product with carbs. It's an easy replacement, so a lot of pastas and rice and cereal and things like that. So we replace the animal intake for carbohydrates, and with that, I do see an increased intake in sugar. There are potential concerns for blood sugars at that point. If you're replacing all the animal for carbs, we know that that's going to increase our blood sugar to some extent. There are nutritional deficiencies with following a vegan diet. I do have to counsel on supplementation. B12, vitamin B12 is strictly only found in animals. So if you do not eat any animal, you should be on a B12 supplement. Vitamin D and calcium are other ones. Iron is a big one. Iron is primarily found if anyone is ever anemia or anemic, iron deficiency. What if your doctors tell you? Eat red meat, because it's primarily the highest in your iron. There are plant-based iron foods, but that is always a topic of concern. And then your protein intake, like I said, you're cutting out one of the main components of protein and you're replacing it with a non-protein food. So protein intake is another one. Weight gain, given the higher intake of refined starches. And then the last two are two that I think are very interesting. I do see a lot of people cutting out meat and they replace it with processed meat alternatives. There are some out there. Morningstar is a huge one. Boca, soy cheese that is processed, things of that nature. And I'm sure we've all heard the controversy surrounding soy intake, which is a whole other topic of conversation, but that's always brought into discussion if you're doing tofu, edamame, tempeh, or your meat alternatives that are in the soy products. Same considerations. I think ethics is one of the main ones. I support any lifestyle, especially if it comes to religion or ethics. There are really passionate people out there in terms of the animal world, and I strongly support that. We just have to work to find a good, healthy balance, and supplements are a huge one. Last one, pegan. This is a very new term. This was eating philosophy that has been coined by Dr. Mark Hyman. He is a functional medicine physician. He founded the Functional Medicine Center at the Cleveland Clinic. He is probably one of the most famous physicians out there. He has a ton of books. He no longer even accepts insurance, and I believe his wait list is about a year too long to see him. So He's very, very good. He's a functional medicine physician like I talked about. Basically, the vegan is the paleo and the vegan combined. So what they've done is they found the best benefits of each, and then they brought it together to provide an anti-inflammatory approach to food. So the basic principles are you're eating whole foods, you're limiting your intake of processed foods, you're limiting your intake of added sugars, you're focusing on vegetables, but fruit is encouraged, high fiber intake, especially because of the vegetables and the fruits, and then the support of high quality animal products like your fish, poultry, eggs, and meat, healthy oils, and they do encourage it to be gluten-free. What I found is that the vegan is less restrictive than following either of those separately. Same really advantages is that it's weight loss, improved blood pressure, blood sugar management, decreased inflammation, improved digestive issues, energy levels are a huge one, and then the autoimmune, remember we talked about gluten. The disadvantages, sometimes we can still cut down on our fiber intake, the too much protein intake. We still go a little crazy on our meats. And then the nutritional deficiencies are your B vitamins if you're following a gluten-free diet. Same considerations as to any of them. Weight Watchers, last one. This one is not it is actually researched, funded by Weight Watchers, ironically, but it is researched. Are you guys familiar with Weight Watchers? I'm sure. It's basically a point system. You're given X amount of points for the day or for the week. There's no food exclusions. There's no food restrictions. Just the points differ based on the foods. So what that means is you get higher points for added sugars, you get higher points for fats, and you get your lower points for the vegetables, the fruits, and your lean protein. I don't knock Weight Watchers. I support that if people like to do it, and here's why. The research is on weight loss, blood sugar management. There's a little research with that. But these three right here are pretty much what I see the most of. You're part of a community. You're given resources. Accountability is a huge one there. So I know that there's like communal spots to go for meetings. So there's group meetings within the community, and then these two are just side in terms of restriction. Weight Watchers does acknowledge food freedom, so there's no foods off the table. You can eat any food. It just you have to figure out if it's within your point system. There are incentives for exercise, so what that means is you actually gain more points on top of your starting point if you're more active. Here's some disadvantages to that. Daily tracking. Anyone who comes to me and wants to talk about calorie counting or Weight Watchers, I just ask them, is this something that you want to do and you have time to do? So daily tracking, sustainability. Points can be skewed in my very strong opinion. They ding really good healthy fats for a higher point system. I don't agree with that. But if you've noticed, do you see that that's a new logo? Because this past year they revised Weight Watchers to kind of get more in trend with the current eating recommendations. So I do see that they are acknowledging and honoring some of these points in terms of healthier foods, but I do still think they have a long ways to go. Intake of unhealthy foods, and you can still stay within your points. And 4 is a big one. I do see disordered eating. And what I mean by that is we can become very, thank you. I didn't want to use obsessed, but I will use obsessed. Very obsessed with these points that I often see. I have a handful of patients on this, or clients. They save their points for the weekend to indulge or have cheat meals. So that can become a mental game. Also, I think I do support the incentives for exercise, but that can also cause some mental aspect if you're trying to exercise really a lot just to gain more points. The last one is the credibility of coaches. I do see sometimes these meetings popping up and recommendations being given out that really shouldn't be coming from that person. So that's always one question, but I think number 4, in my personal opinion, is a huge one. Same considerations. So at the end, I just talked about 5 diets. I did ketogenic, Mediterranean, vegan, paleo, vegan, and then Weight Watchers, just because that's a popular one. So which diet is the best? Don't get mad at me. I'm not going to name one because it really just depends. And what I mean by that is there is a no one size fits all approach to nutrition. If you go to your doctor and your doctor simply looks at you and tells you to follow this way of eating, I'm not talking about a doctor that really knows you, but just you go to someone and they say follow this, I think that that's a huge red flag. There's a lot of considerations needing to be considered. It's important to set a strong foundation and then individualize it thereafter. So what I mean by that is you saw all of those different diets. They all recommended real whole foods. Set that foundation and then figure out what works for you as an individual. So it really does vary person to person, and factors to consider. Genetics and family history are huge. I see that often with diabetes type 2. I always say your family history and your genetics are not your end destination, but it does give us an idea of what road we're on. Another one is your schedule. A lot of some of these, like the ketogenic, is so strict. Does it actually fit within a realistic schedule that you have? Ethics and religion is a huge one that I'm always going to support. Sustainability, financials, your medical history, and your current medical conditions. And then remember, diets will work if you adhere to them. So sustainability is the most important. I would say out of all of those diets, there's research to support that it'll work. Why? Because the people who are the most compliant to it will see results. So that's really what it comes down to. Diets will work if you adhere to it. It's just what's going to work for you. So how I recommend it is start with identifying your goals and what you want out of it, and then go from there. So if someone comes to see me and they say, my main goal, I always start a lot of times with a visit is, what do you want out of this? If I had a magic wand, what is one thing I can do for you? And if it's improve my blood sugars. Okay, well let me see what we're eating. Do you have family history? What do your genes show? What's your schedule? And then I kind of direct your eating habits in that direction. If it's heart disease or cardiovascular concerns, well then I'm going to go more towards that heart healthy research and support that. So I always say just start with identifying your goals and then you work from there. Any research and any article out there, always remember, you probably, chances are, you weren't part of that research. That article, that person talking may likely not know you and your circumstance. So it's important to remember those things. Thoughts or questions? I've identified probably the 5 or 6 most common. There's a million out there. I heard the other day that there's a new diet called the apple diet. Which is quite humorous. It's you eat an apple before every meal, and it helps with weight loss. I wish I could have thought of that diet because I might be rich and really rich in all that. But basically what that means, apples are great in fiber. Fiber fills you up. If you eat an apple before your meal, you're less likely to eat your entire meal. So what I'm getting at is there's so many diets out there. Look at the research behind it, look at you as a person, as an individual, and then go from there. Any questions or thoughts?
No, so we just have to adhere to it.
That's really what it comes down to, adherence and sustainability. If you want, I guess I can say my personal, I think vegan is amazing because it really adheres to 2 separate ones and combines them. And I also think the Mediterranean is a good one because it's pretty realistic to follow. Paleo and ketogenic are hard. Vegan is extremely exclusive. And Weight Watchers, I just think sustainability is always a question. So it's really adherence is what it comes down to.
Yeah, the whole food I think is probably the most important thing.
It's at the
Not
end
eating
of,
that processed junk and.
exactly, at the end of the day, that's really what it says right here. No matter what I talk to anyone about, it's important to set your strong foundation. It's like a home. You can't have a beautiful home without a strong foundation. So all of those diets are really detailed. All of those diets are specific. If you don't start with a strong foundation, then the diets aren't going to work anyways. And heck, if you really follow the whole foods approach, you've taken care of 99.9% of your way of eating and how we should eat. So that's very true. It's a whole foods, real foods approach, and then you really tailor it to your needs. And the reason why I gave you that handout, I apologize, I will send this PowerPoint so that you have it so you can take it. But the reason why I gave you that handout is because those are really the top nutrition pillars that I recommend to all of my clients. And the first one nails it right on the head is real foods, limiting those processed foods. One question I always say, and I'll end it this way. Anytime you're eating, I would just ask yourself, can I grow or raise this food myself? At the end of the day, that should be your number one indicator as to whether or not we should really be eating that on a daily basis, or if we should really be limiting that. Know that I'm a dietitian, but I'm also human, so I do eat some of those foods too, but really the emphasis is that 80-20 or 80 to 90, 90 to 10. A lot of what we're doing is those nature-made real foods. And then everything else typically takes care of itself, and then we tweak it to your needs. All right? Good stuff?
Yeah.
Okay. I think I come back in May, but I could be wrong.
Yeah.
May 8th or something
May
like
8th.
that. I'm going to talk about gut health because I think it's probably the most
Yes.
important topic in health. But I kind of wanted to set this first to talk about the whole foods, real foods, fruits and vegetables. And then I'm going to dive into our gut health and probiotics and prebiotics and your gut-brain axis and how our brain can influence our gut and vice versa. So it's a good passion of mine. If you guys have any questions, you can pass them along and then I'm happy to answer them too.
Thank you.
You're welcome.